With me, we had several pathologists who represented many different interests. We have Dr. Tandi here on the left. Dr. Tandi was coming here on behalf of the County Assembly. We have Dr. Maturi on my right side. Dr. Maturi is my senior also, and he came here to represent the family. We have Dr. Nyachai, who came here to represent the governor of Nairobi. We have Dr. Mwangi. Dr. Mwangi came here as a representative of Mr. Babu Owino. Then we have Dr. Kimondo, who is a pathologist who came here to represent AR, where he died. So when you had a look at the body of the late Honorable, from external examination, we saw that he had what is called cyanosis. Cyanosis is a darkening of the lips and the fingernails. And this is seen in people who, for some reason, are not getting enough oxygen into the body. So it's clear that by the time he died, there was not much oxygen getting to the body. So we tried to investigate why is it that this person was not getting enough oxygen to the body. So we opened up the body. The main finding were in the lungs. There's a blood vessel called pulmonary artery. This is a blood vessel which blood passes from the heart to the lungs to get oxygen. We saw a very big blood clot there, which was even tightly adherent to the blood vessel. And this is what's called pulmonary embolus, and it can cause sudden death. So we tried finding out where this blood clot was coming from. We surveyed the whole body, and upon looking at a blood vessel also in the lower limb on the left called popliteal vein, we saw a blood clot there at the left popliteal vein. So it's very clear that this blood clot came from the popliteal vein, which progressively went to the area in the lung. Then, of course, I saw that there were some symptoms that he was exhibiting, which included dyspnea on exertion, which is getting tired easily. There was also chest pains and difficulty breathing. Because those symptoms subsequently leading to his sudden death. So it's very clear that what caused his death was what is called pulmonary thromboembolism, caused by a left popliteal vein, deep vein thrombosis. You can Google that. But being that it's a very political, high-profile death, and there are so many questions which are there, we decided to take some samples for just to clear any doubt about his cause of death. So there are samples that we've taken for analysis. We've taken samples of what is called histology. Histology is analysis of samples in the microscope. Remember, we've seen some clots. We've taken them. We want to date them to find out how long they've been there. We saw what is called an infarct. On the left lung, there was an area which had darkened. And this is caused by blockage of a blood vessel. So that now that area become infected. The changes in the tissues, because of that, we've taken samples also to go analyze microscopically. Further to that, we've also taken samples for what is called toxicological analysis. There are some issues which came out that maybe it was poison and things like that. Though we are not in doubt of the cause of death, just to clear everything, we've taken samples for what is called toxicological analysis, and they'll be taken into sets. The family also has taken theirs for private analysis, and the police also have theirs for analysis of the government analysis. So that is all. Yeah.
Some samples in form of the stomach liquids that were found in the stomach were taken. Some organ parts were taken. Some viral swabs were taken for further analysis. The doctors representing the government have one bunch of samples. The doctors representing the family have one sample of the document of what they are going to analyze. We will be awaiting the final outcome. Then once I get the final outcome, definitely, the deceased could have not died had he been given the right diagnosis and the right treatment before he met his death. The deceased had occasion to consult medical practitioners before. Once that we get the final report, the family will decide on how to deal with the final report. But for now, the results that have been announced by the doctors are the results that the family has. We shall discuss, we shall look at it, then we shall address either tomorrow or the next day, as the family will give a family statement after these results have been given to us and our family doctor explained to us and the bigger family. Then the family will give the way forward. For now, we wish to thank, on behalf of the family, the media for keeping this story alive, the media, the Fourth Estate, for keeping the dream of Honorable Munuve and reporting in real time the events as they unfold. We wish also to thank the Director of Criminal Investigations Department, the DCI, because they have done a tremendous job. Special mention, the government analysts. Many of the samples have been taken to the government analyst. A lot of tests will be done. Also, the family had hired a private lab to complement the analysis of the government chemist, so that we have a control, so that the results from whatever one institution is compared with the results that will come with the other analysis. May God bless you. Pray for the family. They are at the lowest time. It is a devastating blow, and may the family have peace. Madaktari wamesema kwamba chanzo kilichosababisha kifo ni ile ambayo imeitwa blood clot, kuganda kwa damu ndani ya mshipa ule mkubwa unaobeba damu kutoka kwa mwili hadi kwa roho na kwa kichwa, ubongo. Basi ule kuganda kukapanda, kukaingia kwenye sehemu za mapafu, lungs, ukashikilia pale. Kutokana na yale walifuatilia, ikapata kwamba mwingilio ulikuwa kwenye upande wa goti. Swala ambalo halijadhihirika ni chanzo chake, na ndiposa sample zimechukuliwa ziende kufanyiwa utafiti ili kuweza kubaini chanzo cha kule kuganda. Pili, imebainika wazi kwamba kulikuwa na ishara za yeye kuwa mgonjwa, na aliweza kuenda mbele na kufika katika hospitali fulani. Basi tutapata uamuzi. Familia imeniambia kwamba itapeana taarifa kamili baada ya kuarifiwa, pamoja na daktari wao na wakili wao na familia kubwa. Tutaweza kueleza njia za kwenda mbele. Tunashukuru vyombo vya habari kwa yale ambayo mmetekeleza. Tunashukuru ndugu zake waliokuwa bungeni, ma MCAs, na tunashukuru wote walioshirikiana. Asanteni.